Good morning, everyone. It is January 23rd, 2024. I'm going to call the Board of Health meeting to order. My name is Deanna Diamore, Director of Health for the Norwalk Health Department. On our meeting this morning, we have Norman Weinberger, Frank Ehrlich, Joan McNeil, and Terry Quell, who are board members. We are also joined by Chelsea Foster, Aniela Fignon, Darlene Hoffler, Megan Fogno, and Brian Weeks, who are Norwalk Health Department staff members. Good morning, everyone.
Morning.
Morning.
I'd first like to just welcome Frank. He is our newest Board of Health member. Really fortunate to have him join us. He has a really impressive CV, a lot of amazing experience. We're so fortunate to have him to join a really great group of folks on the Board of Health. So welcome, Frank. Really happy to have you.
Nice to be here.
Our first item on the agenda today is approval of the November 28th, 2023 meeting minutes. Do I have a motion?
So moved.
Terry motions. Do I have a second?
I will second.
Joan has seconded. Okay. Is there any discussion on the minutes? All right. Hearing none, I'll call for a vote. All those in favor say aye.
Aye.
Any opposed? Any abstentions? All right, the minutes pass. Thank you. The second item on the agenda is epidemiology update. So I'm going to pass it on to Brian to give his report. Good morning, Brian.
Hey, good morning, everybody. So it will be short and quick, but I'll jump right into it in terms of just updating on what the respiratory illness situation is for the city. So let me just pull it up. Okay. Alrighty. So what everybody should be seeing, and I'll kind of go into just a quick level of detail just for Dr. Ehrlich, just so to get him familiar with this. What you're seeing is the CDC new COVID hospital admission rate by county for the past week or last 7 days. And as you can see here, it's a 3-tiered system with green, yellow, and orange, green being low, yellow being the moderate medium level, and then orange being the high level. As you can see, it's a mixture around the country, but as with the Northeast, there is a mixture of obviously even yellow and orange, the medium and moderate levels. For example, like Long Island, Nassau and Suffolk counties are in the orange or high. So again, that's a COVID hospital admission rate of about 20 or more. But as you can see, the state of Connecticut, all 8 counties are in the yellow or moderate level. So again, that is tied to certain recommendations or guidance, which, very quickly, again, as a reminder, is at the individual level, in terms of steps that one can kind of take in terms of prevention is, staying up to date on vaccination. Especially for the big 3, we have vaccine for all of them. And so that's really great in terms of, obviously when somebody becomes eligible for it, to seek that out and, to obviously help with reduce the severity of outcomes. Maintaining ventilation improvements, avoiding contact with somebody who's suspected to confirm COVID-19, following the isolation protocols accordingly so they're not exposing others when they're, in a highly transmissible state. Follow the recommendations for somebody for what to do if you are exposed to someone with COVID-19, and then again, somebody that's a high risk of, experiencing illness or susceptibility, talking with their healthcare provider in terms of additional prevention measures. And then so obviously because we're at the yellow level as well, along with that, again, those that are more susceptible or, vulnerable to getting very sick, wearing a mask indoors in public, again, that's something in concert that will be worked out with one's healthcare provider, because obviously there's also respiratory, chronic respiratory conditions that one may have that might complicate that. And then if you have household or social contact with someone at high risk for getting sick, consider self-testing, or presume also that, you might have been, you might have the illness too, because, there's a higher proportion and prevalence of that going on at the time. So, that's just a reminder. Again, sorry to kind of repeat this a million times, but just make everybody aware again what the guidance is from the CDC, relative to this very important metric. But then looking at other metrics, so this is the wastewater monitoring. So again, looking at the concentration of SARS-CoV-2, the virus that results in COVID-19. As you can see for Fairfield County, very fortunately, again, it's been showing a downward trend with the recent data. This is collected once a week. And as you can see, we kind of peaked near the end of December, which is very interesting. You know, it's a little bit earlier, actually, relative to the data information we get for this. And this is further substantiated when you look at it for the other counties that data is collected for relative to the wastewater monitoring. The peaks are evident in Hartford, Middlesex, and New London counties as well. So that's also just really good to see that confirmation with the wastewater monitoring, because that's usually a preliminary or a precursory indicator of what's to come, you know, because the hospitalizations obviously follow relative to those that are obviously experiencing more severe outcomes. And so as you kind of probably read many a times or heard me obviously kind of present on what was driving kind of the current activity for COVID-19 was the JN1 subvariant. And as you can see, it's grown in proportion with the prior week's reporting, you know, somewhere around 61.6%. It's now at 85.7%. So again, very evident that it's running the show because, you know, second place, it's HV1 at 5.3%. HV1 we were dealing with prior to JN1 before it entered the picture, but it obviously is very successfully outcompeting all the other subvariants and evident throughout the country as well. And then, you know, looking at the, again, the severity of outcomes being the primary indicator here, the weekly emergency department visits by age group, looking at it for all ages for the big three. Again, that peak is evident for influenza and for COVID-19. So influenza is in the blue here. In the green is COVID-19, and then RSV is in the purple, which has, you know, fortunately plateaued earlier in the process and has been on a very gradual downtrend. But all three are experiencing a downtrend at the moment, nationally speaking, which is very nice to see. Now, looking at it for specifically the state of Connecticut, this is again from the state health department. This is their weekly emergency department visits for the big three as percent of all emergency department visits in Connecticut for the current season. If you look on the right-hand side, as you can see, COVID-19 and flu have shown at least the first data point, because one thing I did want to preface is that the state health department's a little bit slower with updating this. So as you'll see, if I hover over here, you can see the data is up to January 6th. But as you can see with that recent data point, COVID-19 and flu is kind of mirroring what the national trends are. Although in terms of volume, we are experiencing a larger volume of weekly emergency department visits with COVID compared to the national trend, which was flu. But we are also mirroring, you know, in terms of the RSV situation, the downtrending there. And again, we peaked, you know, much earlier in the season. Relative to that, which is good to see because that's a lot of pediatric patients that would be impacted relative to that. But again, COVID-19 is the primary driver relative to those ED visits. So overall, good news to show that downtrend at the moment, and we should anticipate once this data point's updated from the state health department, should continue that, just kind of mirroring the national trends and the wastewater monitoring. But at the same time, we're still, you know, not completely out of the woods, as you know, as a reminder, you know, Fairfield County is still in the yellow along with the rest of the Connecticut. So we'll be making our way out of it. But at the same time, we can also encounter other peaks, you know, and upticks as well, especially the one thing to always keep an eye out for is spring break in March. And so that's something we would definitely want to, you know, be prepared for as well, just getting through the remainder of the season. All right, thanks, everybody.
Thank you so much, Brian, for that update. Does anybody have any questions or any discussion?
Nope.
Okay, thank you. Thanks, Brian. So next up, we have an update on World AIDS Day. We hosted an event in December 1st at the health department to recognize the day. And I really want to thank Chelsea and Darlene for their leadership in putting this together. So I have some slides that they put together just to show you a little bit about the event to report out. So Darlene and Chelsea, I'm going to pass it on to both of you, but give me a second to share my screen.
Good morning, everyone. I just want to thank everyone for inviting me to your Board of Health meeting today. I will be speaking very briefly on World AIDS Day. So as Deanna mentioned, World AIDS Day is held annually on December 1st. The theme for the past World AIDS Day was Remember and Commit. So remember those who have lost their lives or succumbed to the disease, and commit to ending the stigma and raising awareness regarding HIV and AIDS. So here we have our marketing flyers. I just want to thank Teresa and Julia from our Community Health Department for putting together these flyers, both in English and Spanish. We decided as a department to, of course, play a role in the day and commit to raising awareness by holding extra clinical days for free, rapid, and confidential HIV testing. And we also have a press release on the right side here. So this table was held in our waiting room during the month of December, just with some educational topics on HIV, its prevention and management. There were also little knickknacks that individuals could pick up at their leisure. In this slide, we have our director, Deanna, speaking as we kick off the World AIDS Day on December 1st. We were also very privileged to be joined by some of our state and local representatives. We have State Rep Kadeem Roberts, Council Member Dominique Johnson, Jalen Seed, and we were also lucky to have our DEI officer, Latoya Fernandez, amongst others.
Chelsea, can I just jump in and say, so Dominique Johnson is now a state rep. So she used to be a former council member, and now she's a state rep. And we have, Doug Sutton and Melissa Murray on the council. And so just, yeah, so thankful for them for being there.
Absolutely. And here we have Dominique Johnson, Jalen Seed, and Latoya Fernandez, adding some important words to commemorate the day. Here we have myself saying a few words, but we were also very privileged to receive a citation from the state of Connecticut. We also received a proclamation from our mayor urging citizens to remember the day and commit to ending the stigma of HIV and AIDS. And of course, last but not least, we have the amazing team that I'm privileged to work with on a daily. I just wanted to give a special thank you to Deanna and Darlene for their great leadership and their unwavering support. Thank you, guys.
Thank you so much, Chelsea. And I don't know if I said this at the beginning, but Chelsea is our nurse practitioner, and she does a really phenomenal job. Love having her in the health department. Darlene, do you want to add anything?
I want to thank the entire team for all the work that was done. Chelsea did a great job pulling this together. The community health team stepped up. Our administrative team also helped out tremendously, creating the display board. And of course, Deanna, for your support and leadership. Truly appreciate that. We tried to do this for the community for different days, whether it's World AIDS Day or STD Awareness Month. And we look forward to doing it in the future. So hopefully it'll pick up steam. Thank you.
Thanks, Darlene. And good morning, Janet. Happy to have you with us this morning. And I just want to add, we've been talking a while as at the board about, raising awareness of the health department. And that's something that Frank, that was one of his first, guidance to me too, is like, how do you get the word out about the health department more and the great work that's being done. And so, we had that event earlier in the fall about the flu vaccine. And so we'd like to do more and more of these events. And so if there are different topics or things you want us to highlight, would love your collaboration and partnership, at the board level, and get you guys speaking, at the mic. So we'd love your ideas, whether it's now or later, but we should think about scheduling, several of these throughout the year. Because, News 12 was there, and thank you, Chelsea, for doing that interview. It's important. Any questions or comments from the board?
Looks like it was an awesome event, and I agree. I think it's a great idea to do a few of those a year and get some more press out there. It'd be excellent. And highlight our great staff.
Thanks, Terry. Great. Thanks, Darlene. Thanks, Sophia. Next item on the agenda is emergency preparedness updates. So I just wanted to give a couple, highlights of what's going on in emergency preparedness. So as you all know, we have the emergency response team, and typically we have sessions in the spring and the fall for recruitment. So we are happy to have 8 new members to the team that have been recruited since the fall. And during the fall, Gwen Iannacone and Dana, who's our new volunteer coordinator, they hosted meetings. And so ERT members learned, about FEMA trainings. They completed courses such as Incident Command System and the National Incident Management System. They also were fortunate to be able to complete a hands-only CPR training. We often find that the ERT gets great trainings, and they give us ideas too about, oh, this sounds really great. Maybe the staff should do this too, or, we should expand this to other departments. So we get great ideas from their work. We have an upcoming meeting at the ERT in February where Kelly Tomlinson, who is our health educator, she's going to join the meeting and provide an overview of our Know Your Numbers program, which, holds free community screenings, and they include blood pressure checks, blood sugar, body mass index, waist circumference, and mental health screenings. And I feel like Teresa has talked a little bit about the Know Your Numbers in some of our meetings, but if you want a more in-depth overview, I'm sure Kelly would love to join this meeting as well. We're also going to be doing a fire extinguisher training at an all-staff meeting in February. We did this years ago where we had a fire inspector on site to conduct the training, but we're going to do that again with our staff. And we are going to be doing more recruitment in preparation for the spring for the emergency response team. So we'll be sending out communication soon for the spring. And we also have put money into in our workforce development funding from the state health department to bring a consultant on board to look at some of our plans and to do some trainings, some tabletop exercises with the staff and the ERT. And also to, one of the things I want to look at is, how are our plans, evaluate our plans in lieu of how we operated during the pandemic. What were the things that we did? What were the things that we did maybe slightly differently? What are the lessons learned from our pandemic response that we should be incorporating into the plans moving forward? So that's something that we're also working on too, is, getting a consultant on board to help us advise on some of the preparedness efforts. Does anybody have any questions about preparedness? Joan, you're muted.
Sorry. I was fortunate to be a part of the fall group. Great group of people, great training. And so I just wanted to put that out there.
Thank you, Joan. See, we have amazing members. All right. Thank you, Joan, for we got you on the board and we've got you on the ERT. All right, next updates are our budget. So as you all know, it's budget season, and so we put in our requested budget, and we're still waiting to hear on what the mayor's recommended budget is. But I did want to let you all know about some of the requests that I had put in for the health department. So one of the things that I've been going to the Board of Estimate and Taxation about in the past couple of years has been requests for additional funding for relocation services. So the health department is responsible if residents need to be relocated, renters, tenants need to be relocated due to code enforcement activities. If their apartment, their house isn't, they can't live in it anymore because often it's, a fire that causes relocation, where, we need to relocate the family, but it could be, something structural within the building. It could be the heat isn't working and they need to be relocated. Sometimes that's the faster relocation where, relocate somebody temporarily and you're able to get them back in once that's resolved. The fires and other instances can take longer for relocation. So we're responsible for ensuring that the service for tenants, and we've seen increased activity in relocation the past couple of years. And so we've had to go to the BET more to say, you know, we need to do a transfer, or we need, you know, transfer from contingency. Sometimes we're able to find money within our own operating budget, so we don't need to go outside. But given all of this, I did put an increase for additional funding for relocation. We do our best to, you know, it's hard. You can't really estimate what you're going to need. You hope for, you know, you don't want anything, right? You don't want to use any of this. But sometimes there are things that are occurring that are outside of our control. So that's one of the requests that I had put in for this year's operating budget, is to increase that line item. This year, the budget had been 45,000. I've already, last month I had, or this month actually, I had to go and request a transfer for additional funding. So we got a $30,000 transfer to increase. So given all of that, I did put it in a request for, you know, that line item to be funded at $100,000. So again, don't know what the request is going to be. Don't know, you know, what the BET will say to that, but I just wanted to let you know that was one of the increases that I put in for the budget, given this, you know, the history we've seen the past couple of years. We also have the cost of living increases that we see, you know, with wages, and we also have, because we've had a lot of great new staff members, we've also had the step increases that are part of, you know, contractual obligations. So there are some increases related to that. But we also have some smaller items related to professional services. You know, Smartsheet is a new platform that we're using in collaboration with the Human Services Department. So as you all know, in the efficiency study, one of the items that had been highlighted was technology and enhancing technology. So that's something that that we've been doing too, is working on improving some areas of technology, which was also highlighted as an area for improvement within our own department. So there's some funding related to that. But the thing I really wanted to highlight was some of the staffing requests. So I did put in a request for a full-time public health nurse. We've gone back and forth between, well, several years ago, and Darlene can talk about this. We used to have many public health nurses that were funded through the health department. And over time, that number has been reduced. And so we've been fortunate to have grant funding where we've been able to bring in, you know, a public health nurse. Depending on need, we've gone back and forth between a full-time city-funded public health nurse versus a full-time city-funded nurse practitioner. And so now we have Chelsea, who's on the city budget, and I'm looking to make the request that we have an additional full-time public health nurse to support clinical services. We've seen increased activity, even just within tuberculosis services. We've seen increased, you know, patients needing latent TB treatment. We've seen increased activity with active TB cases. We've seen a lot more childhood immunization. We've had to increase our number of childhood immunization clinics. And so we've seen a lot of activity in clinical services. And we also are, you know, with the pandemic, you know, funding starting to wind down. I'm concerned about grant funding and the availability to support our full-time public health nurse who's on grants, who also is bilingual. So an incredible addition to our team. And so that's one of the requests that I've put in. The other request is we have a part-time person who supports relocation eviction services, who in the past has also done health inspections. I'd like for that person to be full-time. One of the other changes that's been happening is the lead regulations have changed at the state level. The actual state statute has changed. So the level that we're required to respond to conduct a full comprehensive epidemiological investigation has lowered. So our obligations, so this is great public health, right? We want to respond and protect kids. And so we're going to be doing more inspections, and so that requires more work. So I would love for that part-time person to also be lead certified and to be able to coordinate these activities and to oversee it. So having additional person who can do these full comprehensive investigations and support this work, and also following up and making sure we're on top of everything. Lead response requires both the clinical response as well as the environmental response. And so again, I mentioned the full-time public health nurse, but the idea is that this full-time public health nurse could also support lead case management. Darlene, is there anything you want to add to any of that?
Just that, with the influx of, the families coming into the country, our childhood immunization program has really blown up. We are super busy, and our, public health nurses have been very, very helpful in maintaining and supporting the community by getting these kids vaccinated so that they can attend school. So that's a rather big activity for the public health nurse. And with the lead cases increasing, I expect that we're gonna see a lot of activity. So there's definitely a need for our public health nurse. Both public health nurses, obviously, there's going to be plenty for them to do. So I appreciate the effort, Deanna, that you're putting into getting the funding for this position.
Thanks, Darlene. Is there any discussion or questions about any of that? All right. Oh, Frank?
Yeah, I thought maybe this would be my first meeting, I'd not say very much. But as Deanna knows, the subject of the budget is very near and dear to me as a former hospital administrator and physician. I truly believe that the efforts of the Norwalk Department of Health need to be publicized and broadcast, and whatever budget Deanna asked for should be given to her. Now, obviously, that comes with some prejudice, but my reasoning is as follows, and I just sent this to you in an email, Deanna. If one looks at the shopping that goes on in Norwalk, the people from all the communities around us, I'll bet the vast majority shop in Norwalk somewhere, particularly the Post Road area. The two largest hardware stores, Home Depot and Lowe's, are right there. And the fact that we maintain such good health control during the pandemic, let's just take COVID, to me, makes it possible for those communities to continue to survive and to do well. And I think that kind of budget requests for more nursing staff, there shouldn't be any question. It should be just an automatic. The health services provided in Norwalk are phenomenal. The nearest place that I know of, and I don't know what their numbers are, is Milford. Milford has a shopping road much like ours. You can't compare what we have to Greenwich, because I doubt if many of our people shop in Greenwich. So I think the budget is a very important item, and whatever is asked for should be just an automatic, not even go through the grant process. But I know you have to, so I concede to that. Thank you.
Thank you, Frank. I really appreciate your support and your kind words. Thank you. So as far as the budget goes, I'll keep you all posted on the process as we go through it, and I'll let you know how things are going. Any other questions or discussion? All right, thank you. Next is the director's report. So we do have some staffing updates. I want to let you know we have a new community health worker, Omar Perez Rivera, who has just joined us. He comes to us actually from another health department, so he has a lot of great experience from another state. And so this is a really interesting, great position, the way he's going to help support. So he's going to be supporting both like helping with the clinical services part of it. Like, so he'll be able to help like translation. He'll be able to help some of the like front desk admin support, like sometimes it gets really challenging when we have our receptionist who's answering phone calls. People are coming in for environmental health, but we're running a clinic at the same time. So he'll be able to help support some of that like front desk admin work for the clinics as well. And then the important thing is also to get out into the community. So he'll be able to do more, community events for us and do more outreach. So really fortunate to have him join our team. Our receptionist position, we're in the process of doing interviews for that are going well. So hopefully we'll have that position filled soon. In the meantime, we've had our admin support and other staff really pitching in. I can't thank them enough for all that they do. That receptionist position is just so critical to the functioning of the health department. We have our annual report that we finished from our previous fiscal year. So thanks to everyone who's taken a look at it. We're going to be posting it soon to our website. And I know Terry had recommended we send it to the Common Council and DET. So I can certainly do that and send that email and share it with those groups. I will be doing that. Thank you to the staff. Catalina, who is our public health program associate, took the lead on like formatting it with Aniela's support and assistance as well. And then several of the staff members wrote their own sections too in the report. So thank you to the whole team for pulling that together. We are also interviewing for some of our WIC vacancies. So thank you to Darlene for doing that. And I believe Megan is also helping with that. I've been looking at contract execution because we're managing multiple contracts and grants, in particular from the state health department. And that process, there's a lot of steps to it. So I'm working on a tracking spreadsheet where I can follow all the different steps of the process and take a look at, how long each step is taking. And the idea is to turn it into a quality improvement project. And it's really keeping me on my toes too, so that I'm not the one being the holdup in any step of the process. So I'm really challenging myself to like get things like once it's in my hands to move it along, because as we know, the more steps in a process, the longer something can take and the more waiting and holding times. So thank you to Aniela. She's going to be helping me figure out what that quality improvement project will look like. We were fortunate to have Margaret Watt support to come do a Narcan training in December. This is something that Brian really recommended that we do with the staff. So thanks, Brian, for that, and for Aniela and Megan and Catalina for helping pull that together into Margaret. And then the last thing I wanted to talk a little bit more about was COVID messaging. So Ms. Laura Cello was on a previous Board of Health meeting, and she's been on meetings talking about messaging. And one of the things we did recently is, given the high rates of COVID that we had earlier in the month, we did some messaging on Facebook. We also updated our postcard that we've been sending out with the rapid test kits. So we have to, now that we have some funding that got extended, we're going to be able to order some more postcards with, we had a picture of somebody with a mask on the postcard before, but I don't think there was direct language related to mask wearing. So we were able to make some changes to that. So thank you to Megan and Teresa and her team for making some changes to that. And then Brian was highlighted in the hour. He did some great summary and analysis about the respiratory season with some great messaging. So thank you to Brian and thank you to the hour for that partnership for getting the word out again about respiratory viruses and COVID. And happy to see our high childhood IZ rates being highlighted in the news as well. And that again is a partnership with Danbury and our, as you know, our IAP program here is just amazing. They do phenomenal work. So thankful for them. And I think those are my updates. Anybody have any questions about any of that? All right. So I'm going to segue then to public participation. If there's anybody from the public who would like to speak, raise your hands. I see Ms. Laura Cella has her hand up. Aniela, can you bring over to the panel? Aniela, are you there? I guess we're having technical difficulties. Hold a second. Sorry, everybody. Megan, are you at home?
No, I'm almost
Okay.
there. I was just trying to, but I'm not logged in as I'm logged in as myself. I'd have to
Okay.
log back out and log back in. I can try to do that.
Okay. Yeah, I was thinking I could try to do that too.
Let me, I'm on my other phone. Let me try to do that for my other phone.
Okay.
Give me one moment. Do you know what, which Zoom it's on? Is it just the primary one now?
Let me check. Sorry, everyone. We're trying to
Or
figure
is
out
it,
how to bring Diane to the panel because we're gonna try to see if we can log in and be one of the hosts. I think Danielle is having difficulties. Megan, it's on Zoom 3.
okay, give me one moment. I just have to authorize myself and the other. So I have to log into that email account. So give me one moment, guys.
Okay, thanks. Thanks for your patience. Sorry, Ms. Lorachella. We'll get you on soon.
Almost there, guys. Sorry.
Recording in progress.
Thank you, Megan. All right, Ms. Lauratelli, you're now a panelist. Really sorry for that.
Good morning, everyone. Can you hear me?
Yes,
Yes.
we can.
Oh, okay. Well, first of all, thank you, Megan. Wow, that's
Yeah.
a terrific job with the technical prowess. Can't live with those computers, can't live without them. So anyway, good morning. For the record, my name is Diane Lauricella, and I've lived in Norwalk for 40 years. Welcome aboard, Dr. Ehrlich. Based upon what I heard spoken about this morning, I welcomed a lot of what you had to say, and I would like to, on my own time, see if we could meet and talk about messaging. Thank you, Deanna, for noting my discussion at a Common Council meeting, and I do appreciate efforts to improve the messaging on the issue of not only COVID, but viral contamination. First of all, I just wanted to say, with all of the reports that I've listened to over the years, especially during the pandemic, I appreciate the work of the staff of the Board of Health. I have had long-time professional connections with certain staff because I'm a hazardous waste and waste management professional, and that has a lot to do with public health and messaging. So I listened to Brian's discussion this morning, and I just wanted to see in the new year how possibly I could come away from one of these meetings satisfied that the messaging for all the big three, as Brian said, is widespread enough and creative enough. And I wanted to offer a suggestion, and I would like to help participate in it if possible. And I will send Deanna a packet of suggestions. And that has to do with making people on the ground aware of the simple steps they can take to reduce the spread of the viruses, the big three, especially COVID. Mr. Meeks is a very interesting when he gives his talks, both to the council and to you. I really enjoy his voice. He's very rapid talker, but he said more than once the word obviously. It is not obvious to the lay public. Some of the lay public still thinks that COVID is caught by droplets. You all should know by now, I'm sure you do, it is not. It's also an aerosol, mainly an aerosol-based issue, as well as we have other viruses. And I think it would be such a great, even more great service if we could take a look and put like an all hands in on creative messaging related to an upcoming super spreader event that's going to happen. And that is the Super Bowl on February 11th. The reason I spoke this morning is because you will not meet until after the Super Bowl. And I thought this was important enough that maybe I could get some traction on the issue of placing posters with pictures at supermarkets, popular places of public gathering like the library, all the public buildings, especially City Hall. Not that a lot of people, as many people go into City Hall now because we're having remote meetings. Many of our meetings are remote, but at least let's allow, as Dr. Ehrlich said, and I agree with him, with all of our big box stores, we have a lot of people from the surrounding towns coming in and out, bringing their viral load, but also coming away. And I still have been wearing a proper mask into indoor places like ShopRite's, Stop and Shop, Trader Joe's, etc. And I am in the minority. There is a reason for that. And I'm not putting all of this weight on you. I think at every level of government, in my professional opinion, that federal, state, and local health departments are not messaging and reminding people from 4 years ago the different ways that COVID and then therefore this flu and RSV are spread. They do not know it. And so that we cannot say it's obvious, for instance, to ventilate. I've been to numerous events throughout the holidays where adults that are smart and well-meaning and loving do not know what that means. I think the reason we have government is to educate when you know better. So let's find a way before February 11th. We have 3 weeks to find some more creative ways, have common council people go on and do a YouTube or the mayor, and then give him a script that talks about different ways. It is not obvious to people, and those little tiny but interesting charts and graphics, they do not tell, no matter what is said here, they're not helping lay public. I do know that, lastly, I'll just end by saying I am going to follow up with an email as to the response of the staff when I spoke at a common council meeting out of sadness. But the thing is, I've been through this rodeo before, so I know that there's always a report of how many groups they've been to, and I appreciate that, but it's not enough to the regular folks that aren't on special the WIC program, or folks that are in through the middle class throughout Norwalk. It is not, the word is not getting out enough, and let's be creative and have fun. I know Deanna is always likes to keep the morale at a good level. Let's let people have fun and creativity. I have been to vaccine clinics this winter where I got a vaccine, and I'm thankful for that, but there was no information. It was a missed teachable moment on COVID, flu, and RSV. I think that some of the money should be spent on spreading more of the free testing kits, because they're almost $30. Not everyone can afford that. And buying better masks and giving them away at City Hall, and letting people know they're going to be given away in parking lots throughout the city. The vaccine clinics do not have enough education. And I look for that kind of thing, and I didn't see it. And I'm just saying, Deanna and the board, we are not doing enough. Let's do a test case with February 11th, Super Bowl, where people are indoors, laughing, shouting. These are the ways that COVID and other viral that is passed through the air are spread. Let's see what we can do, because those charts are just showing what's happened in the past. It's not the way the federal government has it. When someone has a test kit that's positive, you don't know about it more likely, even though there's little writing that said contact your health department. Most people don't. They just don't, or they stay home thinking they'll get better. So let's just try avoidance, proactivity, and let's try it with the Super Bowl. Thank you so much for all you do.
Thanks, Ms. Lortel. All right. So is there anybody else from the public that would like to speak?
I see no one.
Okay. All right. Thanks, Megan. So I just want just a point of clarification just about Brian. He, his position obviously is epidemiology and informatics. And so thankful for him for all of the guidance that he provides, and the picture that he, the updates that he provides for the board and the council, so they know where we are with respiratory viruses, the guidance and an overview he provides for me and for the staff and for the board and for the mayor. and all of the support that they provide related to contact tracing and case investigations. But as we know, communications is an overall, responsibility of, the fire department, community health and others. And so I just want to point out that his responsibilities are really surveillance, oversight, guidance, and he's part of the picture for messaging, but it's certainly not all on him. So I just want to thank him for all that he does for us. Is there anything else before we wrap up this morning? All right. I hope everyone has a great day. We will adjourn at 8:52.
I need to log back into end meeting, sorry.